Hi everyone. My name is Yabo Antonia. I'm early child educator and a special need facilitator. So I advocate for children with autism, yes, and children with autism. Although I've not heard about it before, but I actually have the knowledge on special needs children. Like special needs children are, like we all know in general contents, that they are children that have disability, maybe like physical disability. But mind you, it's not only children that have physical disability. We also have children that has brain disability. Yes, brain disability. Children that have a neutral disability, that have different brain. Yes, so actually, like I said, I'm not specialized in that, but during my NYSC service I was posted to that department. Like I said earlier, I'm early child educator, so I educate children between the age of 0 to 6. I build their fine motor skill, gross motor skill, develop them intellectually, and make sure they are fitting in all way rounds in their environment. But after my campaign, I camp in Lagos as a COF member, and I was posted to one wonderful school, and that department that I was taken to is learning support department. And learning support department is a department that have intervention that builds students, that supports pupils, children in their academics. And in other way rounds, we have some others professionals such as occupational therapy, ABA, and speech therapy. So along the line, I came in contact with children that has autism, and I was trained to help children with autism. So for the past few months now, I've been working with them, and I was like, what is this? Because they are unique human beings. They are children that are specially made in their own space. Yeah, let me use that word. So the little research I've done has come in contact that it's not everyone that is actually have this awareness on children with autism. So I was like, there's nothing bad if I can just make this little awareness about autism. Like I said, I wasn't a professional in that field. I'm professional in early child education, but thanks to God Almighty that brought me to this department, and I've learned a lot, guys. If I say a lot so far, and I was like, don't let me be the only one to benefit from this. I need to go to the world. I need to come to media. I need to go online, be social about it, and also make awareness. So guys, I've been on YouTube before, but I actually, due to education and some other thing personal, I've not been uploading video. Yes, I think the last time I uploaded video was early last year, 2025, if I'm not mistaken. If I'm not mistaken. So but now I'm back, maybe once in a week or once in a month. I know I'm busy, but I'll try my possible best to upload video. I need to be on autism and every other disability that you guys don't have knowledge on. Yeah. So for my returning subscriber, don't forget to like, share, and comment if you have any question. And if you are new on the channel, you are actually welcome to, and I love you so much. So guys, let's do this. So what is autism? Who are those children that have autism? Autism is a disorder that affects children with autism is a disorder that affects children brain. So we call it a neutral disorder. Anything that has to do with neutral is actually talking about the brain. Yeah, the brain. We refer to them as neutral divergent, and we all know what divergent means, like difference. Children with different brain, where children that does not have autism are referred to as neurotypical. Like typical means common, children with common brain. So if they scan my brain and scan your brain, we that are typical, the scan our brain is actually going to be common. It's going to be common. But children with autism, if they scan their brain, it's going to be a difference. Yes, it's going to be a difference. One may be autism, one may be ADHD, one may be, a lot is not common. It's actually different. So children that have autism are actually referred to as neurodivergent. So I know you guys will love to ask me that, what are the symptoms? I want to know if my child has autism, if my child is autistic, if my child is a child that has autism. So what are the symptoms to know if your child has autism? Number one is they have delay in social communication. Yes, they have delay in communication, in language. That is number one. Number two, they always on their own space. They don't like interact. It's also interaction and communication, just a little bit different. They don't like interacting with their peers. They don't like to play. They're always on my own. I have nothing, like isolated. Don't touch me, please. And another thing is they are hyper focused. ADHD. They are hyper focused. They will be jumping from here to another. They will be talking, scripting, saying things that you not ask them. Yes, those are part of the symptoms. Another thing is that they are repetitive. Yes, they repeat what they echo words. For like example, say hi, instead of them to say I'm fine, they'll say hi. Yes, those are the symptoms. They are not social. They are delayed in language. They are not interactive when it comes to being in the midst of peers. They are hyperactive. Yeah, they are hyperactive, and they are isolated. They don't like mingle with people, and they feel this kind of irritation. They don't like people touching them. So if you have a child and you find this kind of things inculcating, or your child will be developing this kind of behavior, you need to take him for screening. Yeah, you need to take him out for diagnosis, for screening. They will examine him, take him to the professionals. Yes, we have them outside there. We have the ABAs, we have the occupational therapy, we have the Senko. Yes, we have the Senko. And if you don't have any and you want me to refer one to you, just go to the comment section and drop it out. Where can we find these professionals? Where can we find this professional that can help us? And children with autism are always from age 3 to 5. From age 3 to 5, yes. From age 3 to 5. And another thing I know you guys are curious about is how the child gets autism. Yeah, how did they come about autism? I don't have it in my family. And where is it from? Ma, sir, sister and brother? It might be biological. Yes, genetic. Sorry, it might be biological. Maybe your forefathers have heard it before and you are unaware and inherited it. So it's inherited. So that is an advice for we young lady. Before you get married, make sure you do a thorough intervention, a thorough investigation to know the kind of family you are going to, the kind of sickness they have, generational sickness, before you say how you do. Yes. And another thing is environmental. Yes, you have to deal with where your child grew up with. If your child grew up in this kind of rural area, there's a lot of smoke, a lot of shouts, a lot of things, like from their childhood, from their toddler, you know, they are not exposed. Yes, let me put it in that way. They are not exposed. You always put them inside, you let them to go out and explore. Environment, let me just say environment that is not conducive. Yeah, environment that is not conducive. Yes, it can also cause it. And another thing is, third one is drug during pregnancy. Yes, our mothers, our pregnant women, yeah, the kind of drugs you take when you are pregnant can also cause it. So that's the reason why when you are pregnant, you only use drug that your doctor prescribed to you. When you are pregnant, immediately you come to the notice that I'm pregnant, you don't just use any kind of drug, maybe local drug like herb. Oh, my mother-in-law said I should use this. Oh, I feel like, oh, I'm having a day, let me just consume like self-medication. Let me consume this drug just to calm myself. No, don't forget you have life inside of you. Yeah, you have life inside of you, and you can't just do anything that you like, okay? So drugs during pregnancy can also cause it. So let me just stop here for now. So next time we meet, we are going to talk more on what to do, how to go about intervention, and other disability that are not physical disability that you need to know. You know, we have many. We have autism, like I said, we have HDAD, we have Down syndrome. All of these are under special needs children. Yes, and they are wonderful beings. Catch me, they are wonderful beings. So next time, with the precious grace of God, what we meet, we are going deeper. Yeah, we are going to the step 2. So this one is just the introduction of autism. Who are the autism? Their child that affect autism is a disorder that affects children's brain. Yes, children's brain, like developmentally their brain is not developed, and their brain is actually differ from the neurotypical. Yes, neurotypical, and we don't just call them any kind of name. And maybe they are not abnormal. They are children with unique need, and they are referred to as neurodivergent children or neurodivergent child. Yes. And what are the symptoms? I said it earlier. These are the reference. That the symptoms are social communication. You see them isolating. They don't want to communicate. They don't want to interact with their peers. They are hyperactive. Yes, so hyperactive. And they echo words. They are delay in speech or language. And how did they get autism? How did they come about getting autism? Like, what bring about child having an autism that we're at? So it might be a genetic, biological, environmental, and drugs during pregnancy. So this is where I will stop today. Don't forget to like, don't forget to share, and don't forget to comment. If there's any question you want to ask, just go to the comment section and drop it there. And the bell, don't forget to press on that red bell so that anytime I upload a video, you'll be notified. Thank you guys, I love you. Thank you guys, I love you.